Health outcomes. Changes due to interventions. To bring positive change, patient experiences and health must both improve. Healthcare costs must be lowered, and clinician and staff burnout has to end. But our problems are big. 133 million Americans have at least one chronic disease. 500,000 people are dying every year from hospital errors, injuries, and infection. The shortage of primary care professionals will be as much as 100,000 in just the next 5 years. Big problems require bigger solutions. Positive change needs acceleration. It needs to happen now. But these are not so easy solutions that many don't want to hear, and even few are willing to talk about. How to lead such a change? How to discover, discuss, and disrupt healthcare to make a difference now? This is VITALS, Visionary Health Leadership in Action.
Ladies and gentlemen, welcome to VITALS, brought to you by Northeast Ohio Medical University in collaboration with University Hospitals. VITALS is an open forum to hear from our nation's healthcare leaders who are using the VITALS tools, value, innovation, technology, advocacy, leadership, and service to transform and improve healthcare delivery. I'm pleased to be able to introduce today's VITALS speaker, Patricia DePompei. Ms. DePompei is the president of University Hospitals Rainbow Babies and Children's Hospital and the McDonald Women's Hospital. Ms. DePompei has over 30 years of experience in the healthcare industry, serving as a clinician and a leader, especially in the areas of pediatrics and newborn intensive care management. She is also a national and regional leader in the delivery of care and the improvement in the health and wellness of children and their families. She has a particular focus on patient safety, and she is also a recognized leader serving on the American Hospital Association and the Ohio Children's Hospital Association Board. Ms. DePompei is also a trustee for Cleveland State University and a proud graduate of the class of 2016 for Leadership Cleveland. She completed her master's degree at Kent State University in nursing and also completed an executive program series in healthcare leadership at Case Western Reserve University's Weatherhead School of Management. Please join me in welcoming Patricia DePompei. Thank you.
Good afternoon, everyone. I was absolutely honored to be invited to NeoMed today to share my perspectives on the critical importance of engaging a community in order to comprehensively address healthcare needs. As I prepare to retire at the end of this year and reflected upon what might be most meaningful to all of you as you begin your careers, I wanted to share the importance of partnership with our patients and community. While this has long been a fundamentally understood principle of public health delivery, and as you will see, was well practiced early in our U.S. healthcare origins, I believe we strayed a bit in fully appreciating this principle and driving health outcomes. I have often reflected upon this powerful quote from George Santayana, and I'm sure all of you can recognize occasions, whether in life or in your practice, where this holds true. Unfortunately, infant mortality, which is defined as the number of infant deaths in babies under the year of 1 year of age, over the amount of live births in a region, and some might argue is the most important overall number as a marker of healthcare in our society, has proven to be a significant challenge in the United States. Our infant mortality rate is higher than any other high-income country. Well, why is this so? And most importantly, what can we do to improve upon this? The answer, as Mr. Santayana suggests, can be rooted in the past. Depicted here is data that was shared in our first Babies and Children's first annual report. And the causes that were cited by Dr. Kelly can be seen here: overcrowding, nutrition, impure air, uncleanliness, and lack of sunlight. In our second annual report, the following observation was made regarding a household comprised of an immigrant family. And at this time, our infant mortality rate in Cleveland was 20%, meaning 20 babies out of every 1,000 born did not survive until their first birthday. So what did we do about it? The Babies Dispensary and Hospital reached out to form a cooperative relationship with other community organizations, including the Visiting Nurse Association, the Children's Aid Society, the Humane Society, the Hebrew Benevolent Society, and the Day Nursery Association. During the initial period, most babies were brought to the dispensary when they were ill. It was the hope that as the facility gained trust and became better known, mothers would bring in healthy babies soon after birth. To the right of the building that you see there is a leaflet, and that leaflet depicts a sculpture called the Bambino, which is from Florence, Italy, back in the 1500s. And the leaflet was printed out in 5 different languages: Yiddish, Italian, Slovak, German. And that leaflet was distributed all across the community and encouraged mothers to bring their babies to the dispensary, and brought their babies they did. And what you can see here, there was an immediate impact from 1907, where the total number of new patients treated had a mortality rate of 14.5%. Within 3 short years, that dropped to 7.6% in the community overall. And for those babies who had consistent care at the dispensary, the rate dropped to 1.5%. And so by 1923, when university hospitals dedicated a new hospital for babies, children, and women, and I'm very proud to say both of the hospitals depicted there still stand as Rainbow Babies and Children and McDonald Women's. By 1924, our infant mortality rate in the city of Cleveland was 6.6%. So what happened next? Remember, I started with a quote with Mr. Santayana that said, if we forget to remember the past, we're doomed to repeat it. And what has happened, unfortunately, is, if I could get that clicker to work, there we go, oops. Here we go. We backslid. And so by 2015, we were back up to an infant mortality rate in the Cuyahoga County region of 10.5%. And what was even more striking, there was a dramatic increase from 2014 to 2015, rising from 8.1 to 10.5, and we were nearly 3 times the national average. And so we needed to better understand what was driving our infant mortality rate. The most common causes of infant mortality have stayed fairly consistent, and they are birth defects or congenital anomalies, preterm birth and low birth weight, sudden infant death syndrome, unintentional injuries, and maternal pregnancy complications. And just like our predecessors back in 1905, we needed to think beyond our clinics and our hospitals and partner and engage with the community. And so we all recognized while 20% of the clinical care that's delivered at Rainbow Babies or McDonald or Metro Health can have an impact on one's lives, really the greater majority of what impacts one's overall health outcome is related to those social determinants of health. And in fact, study after study have shown social determinants of health have a greater influence on health than either genetic factors or access to healthcare services. So what did we do? We partnered with our community. We recognized that a new approach was needed. And back in 2015, First Year Cleveland was formed. It was comprised of grieving parents and families, frontline caregivers, healthcare systems, and you could see a variety of both civic and governmental leadership. Very proud of the fact that UH Rainbow Babies and Children and Metro Health Leadership agreed to form the lead of that executive committee. And in fact, I'm very proud that I chaired that executive committee in that first year. But we were committed to social change. But we knew that we needed to ground our work in data and context. So again, you saw the statistic, our infant mortality had increased. But even more striking was the fact that not only was our infant mortality rate high, there was a huge disparity between white baby mortality and Black baby mortality. And this wasn't just limited to the Cleveland area. This was seen across the state, both in Cincinnati and Columbus. So at the same time, Cradle Cincinnati was formed, Celebrate One was formed in Columbus, and as I indicated, we formed First Year Cleveland. We knew that it was important that we listened to and acted with the community. There is no reporting structure to the problem. It was critical that the priority was listening and acting. And again, I want to emphasize with the community, not to the community. So in order to do that, we did create 11 action teams, a community action council, and we all agreed that regardless of our site of care delivery or a particular organization, we were going to coordinate our programs and services. In the interest of time, I wanted to share just one example of the 11 action teams. So one of the action teams focused on partnering with maternal and child health and social service providers to identify opportunities to enhance service delivery. So what did we do? We agreed that collectively we would widen the reach of prenatal care programs and use a time-proven methodology called centering pregnancy that actually originated by a nurse midwife in the South, and our nurse midwives in UH brought it to my attention. The outcomes of centering pregnancy, as you will see later, are pretty striking. But holistically across the community, whether it was in the FQHCs or whether it was with other healthcare providers, we all agreed to implement centering. We also agreed that we would do a better job of assuring that women had access to reproductive health services, namely contraception, to assure that families could be appropriately spaced out so that women had a choice as to when their next baby was born. Again, proven to have a significant impact on overall infant mortality. And like everything we do, we wanted to ground the work in data and context. So I shared with you the statistics from Cuyahoga County, but we also needed to really understand what was going on in the city of Cleveland. And so while the national poverty rate in 2015 stood at 15.5%, in Cleveland, the rate was 39.2%. We also had to take a hard look at how we were delivering services. In the middle is how we were delivering primary care services, the clinic, where we were seeing pregnant women and newborns, and that clinic had stood since, I think, 1969 or 1970. And you could see it was tight and it was cramped space and it wasn't very welcoming. Likewise, we also need to fully understand what was driving that poverty rate of 39.2%. In the city of Cleveland, we know there was redlining that occurred back at the turn of the last century, and that really accelerated in the 1930s, that created high degrees of poverty. And in the red is depicted those neighborhoods in which redlining was most predominant. And it is not surprising that it is those same neighborhoods that had the highest rate of not only infant mortality, but lead poisoning and traumatic injuries as well. So we were committed, as I indicated, to take a hard look at ourselves and say, how do we contribute as part of First Year Cleveland, as part of UH Rainbow and McDonald Women's, to do something different? So again, we listened to and acted with the community. We formed a community advisory board. We implemented patient and family surveys for families who were patients within those clinics that I showed you. We had an 85% response rate from those families, 85%. And they told us what they felt they needed to better manage not only their own care, but their care of their families. We also held town halls. We invited the community to be part of this community advisory board. It was a bitter, bitter, snowy, cold day in Cleveland, and I will never forget, we had 100% turnout for that first community advisory board meeting. People wanted to be part of the solution. We also recognized that if we were going to do something different, it was going to require dollars. And as part of a not-for-profit healthcare system, and knowing that the families that we were most focused on serving were insured through Medicaid, we knew that we needed to raise some dollars to support this work. And so we reached out to the community. I'm very proud to be a Northeast Ohioer and a Clevelander. When I met with the community and shared with them the statistics that I showed you relative to the disparity between Black babies and white babies, they were astounded. And they opened up their wallets and they contributed. So we had the fastest fundraising effort in the history of university hospitals to contribute to the build of a new center. And this is the center. We purposefully located the center in that red area that I showed you that was part of the original redlining. And so this is located in the Midtown community. For those of you who are familiar, it's between Euclid and Chester Avenue, between East 57th and East 59th. It's a beautiful, vibrant, life-affirming center. It's filled with artwork that was selected by the community that is culturally sensitive and recognizes and appreciates the beauty of the entire community. But as you could see, the statistics for families we serve are very challenging. 53% of families live within a 5-mile radius of the center, and many are from neighborhoods with a median household income of less than $30,000. So we knew that our model of care delivery had to change. It couldn't just be primary pediatric care and primary OBGYN care. We had to think thoughtfully about addressing those social determinants of health within the context of the center, and address them that we did. Not only, again, do we provide pediatric and primary care and OB care, we incorporated a lab. How challenging was it for families to have to go outside of the site to have their lab work done? Many of the families didn't have their own cars, so they were relying on bus transportation. As a result, they didn't get a lot of their blood work completed. Many of the kids were struggling in school. Why? Because they couldn't see well. And so within our region, we noted there was a lack of providers for children insured through Medicaid for eyeglasses. So we built in an optometry suite within the center. We added dental. The importance of oral health, and I know there's a dental school here as well, cannot be underscored. We added pediatric and women's health dental services. We also recognized many of our families were struggling with issues related to their rental properties. So we worked and partnered with the Legal Aid Society, and thanks to a wonderful gift from the Benish Law Firm, we now have Monday through Friday legal aid services for families who are struggling with issues. We added nutritionists, and we partnered with the Saltzman families on the build of a new supermarket right next door to the center. So Dave's Supermarket is located right across the parking lot. We integrated behavioral and mental health services, again, based on what families told us they needed. We added social support and family activities. I mentioned we really broadened and expanded our provision of centering pregnancy, and we addressed many of the other issues through the wonderful work of an interdisciplinary team, including incredibly skilled community health workers. So I wanted to share with you an illustration of how this works and how this might look very different from a typical primary care visit. And so this is a real story, although the specific details obviously have been covered to protect HIPAA and the family's privacy. But this was a real story. And Aunt reached out. We have a Rainbow Connects program within the center, and she asked for help getting a car seat for her niece who had 2 young children. So the niece was seen with the aunt in our Rainbow Connects program. The Rainbow Connects team member, who by the way was a volunteer student, so we employ a lot of volunteers to help with this work. She met with the niece and found it wasn't just a car seat issue. The niece was actually fleeing from a domestic violence situation. So the team provided that referral for the car seat, but then also recognized she was in grave need of food and clothing and diapers and toys. And she connected the niece to a social worker. The social worker then did a full assessment and of the niece's and her family's health and wellness needs and identified that all were overdue for their annual clinic visits. So the niece was able to visit the OBGYN, and we also incorporated childcare within the center so she could concentrate on her exam while her children were having a ball right within the center. And then the kids went to their visit. We also recognized, the social worker did, that there was a need for social health services, and we integrated behavioral mental health services within the center. And so I'm really, really pleased this family is well on their way to a much more promising future, but it all started with that initial request for a car seat. Again, in a traditional healthcare setting, you don't have a lot of time. You can't meet all of these needs. In the Rainbow Center, we purposefully designed it so that we can look holistically and really address those social determinants of health. Everything we do, however, is grounded in data and measurement. So we measure every program and every service. We don't want to be adding services because it makes us feel good. We want to add services because it collectively impacts the health outcomes for that child, for that family. So pleased to say the center opened its doors in July of 2018. The community responded en masse. You could see the growth. This was 2021. This is just primary care, pediatric, and OB visits. When we add in dental and optometry and lab services, the clinic last year, the center last year, saw over 130,000 visits for services. But again, rooted in data, is it making a difference? On the bottom, I share with you data from our Centering Pregnancy program, which again, I want to give great credit for our UH nurse midwives who really led this program to fruition. I see Selena in the audience. Selena Kunanen is here. And it was really under Selena's brilliant leadership that was done. But they collect data ad nauseum. I'm constantly asking, are we moving the needle? Are we moving the needle? In this year, our Centering Pregnancy mothers, 8% delivered preterm versus 12% overall in the county, making a difference. 6% of the babies were born at low birth weight versus 11% born at low birth weight. And remember when I shared the data on infant mortality, preterm birth delivery and low birth are two of the key indicators for infant mortality. So addressing that was critical to addressing the overall problem. Very pleased to say, after starting First Year Cleveland in 2015, opening the UH Rainbow Ahuja Center in 2018, we were part of the community solution. And as a result, our Cuyahoga County infant mortality rate dropped to its lowest rate in 30 years in 2020. We saw a further drop in 2022. However, our work is not done. We are still seeing absolutely unacceptable differences in the rates of infant mortality for Black babies versus white babies. And so our team is committed to continuing our partnership within the community with the families that we're so privileged to partner with on their healthcare journey. But we really use this mantra: children are 1/3 of our population and all of our future. So I can say our work is not done, but I'm proud of these beginning indicators and really looking forward to the day when our infant mortality is down to the lowest rate it possibly can be. And there is absolutely no difference in those mortality rates based on a baby's race or community in which they live. So again, I thank you for having the opportunity to speak to you. I wish you all well in your healthcare journeys and in the many contributions you're going to make in ensuring better health outcomes for all the people in our respective communities. Thank you. Oh, and now I am very pleased to welcome a dear colleague who I've known for a number of years, Dr. Forrest Faison, who I believe is going to ask me some questions. There we go.
Thank you for being here today, and thank you for your amazingly inspirational words and talk today.
Thank you.
And most importantly, thank you for being such a leader and having such an impact on Northeast Ohio in the area.
Under your leadership, UH Rainbow
Babies and Children's Hospital has received numerous national recognitions and accolades, and now is widely recognized as one of the top pediatric hospitals in the country. How, from a leadership perspective, did you achieve such impressive results during your tenure as the CEO?
Well, thank you for the question, but I'm going to flip it back to the title of my talk, and It Takes a Village. So outcomes, results really are the result of a team working together. And I am so proud to be part of a team that is simply the best. It's a team that wakes up every day saying, how do we heal better? How do we teach better? How do we contribute to new discoveries? And I view my role as ensuring that the team can do what they do best and that they have the resources and the support necessary to execute upon which they do so well. So I would say that really was my contribution.
Well, it has shown so well in so many accomplishments and such a gem and such a jewel for Northeast Ohio. So thank you for that.
Thank you.
Meeting the needs of the community was a central theme of your talk. And it is so important for Northeast Ohio and really other areas in our country as well that want to grow, that want to have economic growth and development. Healthy economies are built on healthy communities. What advice have you got for healthcare professionals and organizations that can work in this area and do things from action to implementation?
Well, I'm so proud to be a part of an organization who, from the very beginning, as our CEO, Dr. Megarian, often repeats, the needy are the most worthy. And so I think it's really important as we think about organizations that we want to be a part of, you think about being part of an organization whose values align with yours. And then how do you work together, as I indicated, as a team to really roll up your sleeves, dive in, review the data, develop a plan not based on what feels good, but based on evidence-based data. You know, the evidence should always drive the work that we do and should also understand when do we need to say what we started sounded like a good idea, but may not be as effective as we thought, and not be afraid to say that. You know, that is part of the academic environment, that we're willing to take risk, to explore, but also equally adept at saying we need to pull back and pivot and do a new mantra. And then I would say the other piece of advice I would give, that partnership with our patients and our families. Again, I know that's core to the values at UH, that we partner with our patients, we partner with our community, but I would say you can't do it in isolation. And sometimes Forrest and I had the opportunity to meet with students right before this. And I was sharing with them, sometimes we get too colloquial and think we know it best, when if you really listen to our patients, the families we care for, they'll tell us what is making a difference for them and what they need or don't need. And I think we have to be humble enough to accept that feedback and change.
Absolutely, absolutely. You know, infant mortality continues to be a challenge, and you've made such enormous improvements in this area, but it continues to be a challenge. As you look at healthcare organizations, what advice have you got for them, and what are some strategies that we might think about to really change that? Because that's our future, and how can we make a difference to improve that for all Ohioans, and at the same time set the example for other parts of the nation?
Well, you know, infant mortality doesn't occur in isolation, right? And you can't have an infant without a mother. And we need to really be very thoughtful about supporting the healthcare needs of women. I shared, you know, some examples of ways that we thought about that, but many women are presenting into pregnancy in not the best health state, whether that is comorbid conditions like cardiovascular issues or diabetes. It can also be mental health stressors. And for women living in poverty, the experience, their daily life can be filled with stress. And so for other healthcare providers who are thinking about how do we move the needle, we can't look at what is considered typical medical or nursing interventions. We have to address those social determinants of health. We have to address things like redlining, which created, or which was rooted in racism, which has led to neighborhoods that have lived for generations in poverty. We have to be honest with ourselves and say, until we're willing to tackle those issues, we can't move the needle on health outcomes. We can't.
Absolutely. Building on that, one of the lessons that we got from the COVID pandemic was that trust in the healthcare system is not a given. And how can we build trust in some of these neighborhoods to really help us be impactful in improving the health of these folks going forward?
Well, again, I think in the community has generational experience with caring for family. And so one of the things that we did as well is really open our doors to doulas from the community who can partner with women who are experiencing labor, who have that trust and confidence with a sister from the neighborhood, who can interpret and acknowledge when they're in pain or when they're trying to deal with a whole myriad of healthcare providers. Again, it's that concept of opening our doors and partnering with the community in a variety of ways.
Yeah, and you've talked about it, and I think the Ahuja Center that you so nicely shared with us today is a good example of getting into the community. It seems pretty clear that that's the way of the future, and yet we're in a healthcare system that doesn't really always reward that or incent that. So how might we develop strategies to be more in the community where our patients are instead of making them come to us?
Well, I think this is where, again, all of us need to think thoughtfully about our role of being effective advocates for policy changes. And so we know there's absolutely a place for that high-end tertiary quaternary care, and we need to assure that we're able to continue to invest in that. There's also a clear role for a very effective evidence-based public health system. So I encourage all of us, the next few years are going to be critical as we think about public health rooted in evidence and things that we can do to advocate with our voices for things that are effective and things that are not rooted in evidence and may not be effective. That would be my recommendation.
Absolutely. You have been an amazing leader throughout your career. What advice have you got for aspiring leaders who will carry your work forward and make a difference in the future?
Well, first and foremost, I have always been so humbled. I was sharing with a group of our community partners. I really began my career when I was 13. I started as a candy striper in a local hospital, and then I worked in a nursing home, and I worked all the way through. And the advice that I could give for anyone, regardless of the discipline, regardless of the role you play, is really never being afraid to participate as part of a solution and rolling up your sleeve and diving in. It's not about the title. It's not about the accolades. It's not about the awards. It's about contributing to better health outcomes. And when you're willing to kind of roll up your sleeves and dive in and partner and be humble enough to be part of a team, really rowing in the same direction, the outcomes can be extraordinary.
Absolutely. It seems like you're saying put the patient at the center of your thinking, because that's why we go into the health professions, is to care for others. So as you near your retirement in the next chapter in your life, what advice have you got for folks going forward, our students going forward, those who are listening in the community that might be thinking about leadership opportunities, that might be wondering, should I go in this direction? What made you go in this direction, and what advice have you got for them?
Again, from the very first moment that I interacted with a patient and they said thank you, not that a patient always has to say thank you, but it warmed my heart. I got back so much more than what I gave. And I have found that throughout my career. That being said, healthcare is a challenging industry. Not to talk finances, but I will. Healthcare margins are very thin. The needs of our community are very great. It takes individuals with courage. It takes individuals who have a willingness to work hard to dive in. But personally, I can't imagine a career in another service. It has been so personally gratifying. And again, I'm just so proud to have been part of a team who has really contributed to some really terrific outcomes that will go on to inspire the next generation, will go on to contribute to the next generation within a family.
Yeah, absolutely. We talk about healthcare is an art around which we wrap science, but at its core, it is an art. And to your point, we are very challenged today in our nation to have a healthcare system that meets the needs of all Americans, and raises the health of all Americans, and from that, the health of our communities. So I hope that you will continue to be involved as you start this next chapter in your life. And there is so much that we can learn from you, and so much that we can take away from your experience to go forward. And so I want to say thank you for that, and thank you for the difference that you have made for so many folks that you may never have had the opportunity to meet, but are more grateful than you'll ever know.
Thank you, Forrest.
Any final words at all?
Well, first and foremost, I think we are so lucky to live in a country that really is ultimately at our core committed to doing well. Like if you look at our history, we're willing to roll up our sleeves and do well. That being said, we have some tailwinds ahead of us. So, I just encourage all of you, use your voice, be advocates, root that advocacy in evidence. And, I know we can effectuate positive change. I just know it.
Absolutely. Well, Hetty, again, thank you so much, both for being here today.
Thank you.
Thank you for a career of impact, of service, and of making a difference for others. Let me see if anyone in our audience has any questions. Dr. Langell.
Yes. Ms. DePompei, thank you very much for an incredible presentation and sharing the great work that you are doing at Rainbow Babies and Children's. You noted that about 30% of all patients are in the pediatric group, and it is 100% of our future, and yet physician workforce and nursing workforce continue to be a challenge, as do payments. You mentioned the reduced margins that you're seeing, especially in the pediatric space, and yet I think as parents, this is the number one area that we care about. Pediatric residencies had one of the lowest match rates in their entire history this year. How are you dealing with the workforce challenges, especially around physicians and nurses? And what do you think the ultimate cause is? Is it finances? Is it burnout? Is it professional satisfaction?
Thank you, Dr. Langell. That is a loaded question. It's a really tough one. I would have expected nothing less. I think like everything, the problems are multifactorial, right? So if you look at pediatric residencies, we were very fortunate at Rainbow this year. We had one of our highest successes in terms of the match. And so what that tells me is that trainees recognized there was an opportunity to really be effective and to further their career within our setting. That being said, there are real changes coming about within the pediatric residency that will be implemented in 2025. And I don't think they're wrong, but they pose some challenges. So for example, our residents will be spending much less time in the inpatient setting, much more time in the ambulatory setting. It has meant that we've needed to reshift our workforce to address those changes. So we're going to have a significantly less residents and really increase our number of APPs and other professionals to provide that work. That being said, we also know within the pediatric workforce itself, the reasons why we see those matches typically lower across the country, I do believe there's a degree rooted in finances. So if you look at salaries, for example, for a pediatric gastroenterologist and adult gastroenterologist, very different. Very different. And you could go on with pretty much every pediatric specialty. There's a significant pay differential. So fundamentally, I think as a society, we're going to have to think very thoughtfully as to how do we address and assure parity so that individuals who have talent don't have to choose based on personal finances and loan payback and all of those other things, and know that their ability to remake those dollars over their career could be limited. On the nursing side, I know Michelle Hereford, our chief nurse executive for the system, is here. Michelle has led our nursing leaders around incredible initiatives to really inspire nurses to see the full potential of nursing as a career and to see the very many different ways nurses can contribute, whether it's direct clinical care at the bedside, whether it's moving into advanced practice roles, but also to supporting other individuals who want to step into nursing from other careers. So we have to think about it in a very multifactorial way and be creative with our responses because there are real challenges.
Great, absolutely. Thank you. Other questions?
Hi. You mentioned, especially with regards to community outreach, that the new facility that you guys built was in the middle of a historically redlined and underreached community. How important was it to have a physical location that's like physically in the middle of this underreached community, and what were like some of the tangible benefits that you guys saw of being present in that space?
Thank you for that question. We realized, I showed you the clinics that we had that historically had been on the first floor of Rainbow. We had a women's clinic and we had something we called the RAP clinic, Rainbow Ambulatory Practice Clinic. I think they opened in 1969 or 1970. They were in very tight, cramped spaces. But what was equally important was for families who were coming to the center, and I'll never forget this day. It was a Halloween day. There was a young mom who was pregnant, who had 3 little ones, who had to take 2 or 3 buses to get to us because we weren't located on a direct bus line. We also were set back from the main road in an academic university campus, so not really conducive to families coming from the neighborhoods for primary care delivery. So we knew we had to move. And I'll be honest, that wasn't a really popular decision with many of our providers because they had been used to being part of the overall hospital and part of the energy and excitement, and were concerned about moving. But when they heard from the community about how important it was to be closer, to be more readily accessible, they responded and they understood that we needed to be out in the neighborhood. And the first day we weren't quite open for business, a little boy ran in through the doors and we said, "Oh, excuse me, what are you here for?" He said, "I had to come and see my hospital." And that told us something right then. He saw it as his hospital. So part of the community, part of the fabric, I mentioned the artwork is reflective of the community by local artists. All of that, you think, that couldn't be that important. It all tells the community, you matter to us. You deserve beautiful space. You deserve life-affirming space. You deserve space that's closer to your home that you only have to take 1 bus to get to, or you could park your car in the flat lot right next to us. It made a huge difference. And I think the volumes that we're seeing, I mean, the greatest challenge we have now is we need to add additional parking. We are really, really busy. We're seeing lots and lots of visits. But again, people vote with their feet, and it made a difference.
Well, we're almost out of time, and I'd like to ask you one final question. So as you reflect back on your career and all the things that you've accomplished, as you look at that young high school or that young undergraduate, why healthcare? Why would you go into healthcare as a profession?
Oh, the ability and the privilege to be a part of someone's lives when they need help and aren't feeling so well, to be able to have an impact and contribute to making them feel better. I can't think of anything better. It's so gratifying. So I would say you have the ability to have an impact and contribute to someone's lives in ways that are multiplied, tenfold over their lives.
Well, I will tell you, when I look at your career and all that you have accomplished, you have lived those words. Patty, thank you so very much for all that you have done and the difference that you have made for so many. Thank you again. Thank you, Patty. Thank you.
Dr. Faison, thank you for your moderation. Patty, thank you for such an amazing presentation. Your passion is obvious and your impact is absolutely incredible. Until next time on December 5th, please join us when we hear from Laura Adams, the Senior Advisor to the National Academy of Medicine. Between now and then, stay active and stay engaged because transformational healthcare leaders like Patty DePompei do not happen overnight. She became active and engaged in her community and making a difference early on in her career to be able to grow to the incredible leader that she is today. Go safely and enjoy your week.
This is VITALS, Visionary Health Leadership in Action.